My name is Robert Payne. I have been diagnosed with Parkinson since 2008. And this is my wife, Pauline. And she's been an integral part of my support system, so I asked her to come along today so we could talk to you about natural fit physical therapy. Yeah. So I began to do Rocksteady boxing for Parkinson's. And when I say boxing, I mean we actually engage the pads that somebody else is wearing, and the bags, heavy bags and the small bags. And
you don't hit each other.
We never hit each other. It's non-combat boxing. And it involves footwork, and just like dancing is good for Parkinson's, well, so is fighters' footwork, because you have to think about what you're trying to avoid and how your feet, you have to learn to move your feet so that they move without you thinking about it. Or the guy wearing gloves on the other side is going to take you down. So I enjoyed that, but it wasn't quite enough. I had severe back pain because I'm 6'4", 6'5", somewhere in that area. And I had to bend over to hit most of the bags. And after half a session, which went for an hour and 45 minutes, I was feeling like my back was killing me. Natural fit therapy has some of the greatest people in the world. I was actually filled out a questionnaire, if I remember correctly, on what I liked best about the physical therapy at Natural Fit, and I said to people, I make a lot of jokes about Ryan, but that's because we've become very good friends. And the rest of the staff, Valerie and every one of them, are just so great, and they are so positive, and they are happy to see you, and happy to help you. Well, I've talked to a lot of people that have Parkinson's that I know and have recommended big therapy, and I think I get from them the same general answer, and that is they don't want people to see them at their worst, which would be learning the exercises and possibly falling. But like I said before, Ryan will just pick you up, dust you off, and you do it again. And you do it again. And pretty soon you're doing it and you realize Ryan is just standing there watching you. So I think people need to understand that nobody will be calling you on being bad at something, and no one will call your Parkinson's the worst they've ever seen. They'll just help you be better. And I think that's part of the problem. People are afraid of looking bad, looking embarrassed, and they shouldn't be, because even with 16 sessions, which is what a big therapy is, you just travel a road from not being able to do it to doing it all by yourself. Yes, I achieved it. I wanted to be taller. I wanted to be my height again. And I wanted to get out of bed without a backache. And I wanted to just get out of bed without help. By help, I mean the dog or something else I could grab hold of. And now I just swing my feet off the bed, pop right up. My back is so much better. I still have bouts of backache pain, but when I do, I hear Ryan say, well, do the exercises, you fool.